Testing the speakers again. Testing the speakers again. Testing the speakers again. Good evening, Dr. Deborah. Yes, we can hear you. Good evening.
To speak to her. But she has to come on to the...
Yeah, I think.
she's you.
Hi, good morning, Dr. Bradshaw. I'm Vishala, Aashrai's mother. It's lovely to see you joining us, and it's a sort of a lot of nice feelings we have because I still have the Christmas card which you have sent when he was selected at your place, and that's a treasure. That's a treasure. And Aashray was one person who really, I think, like admired you, liked you, and lot of affection for you. So I think it is very, very nice of you to have realized, to have recognized that his quality fellow. That makes me very happy. That a doctor who has a good quality for his patients, and then and then you have passion for your patients, you look down for patients, and you see for the best of the patients. Nothing more is required than thus humanity in a doctor. So I'm actually today, I think I have overcome quite a lot, and I feel happy that this guy Aashray, who's such a humble and human person, affectionate, and who loved you and respected you a lot, and you're sharing everything for him with us too, and you are great. And I would say, like, I would give you my salutations actually. A great person bringing over so many other good doctors under you. That is what. And Aashray was the guy, like in our family, most loved, and everything argued, whatever you say. He was the warmth in the family, and the warmth is increasing. Today I am very happy as you made us more lively when you had put up a obituary meeting, and then more than 200 people attended, and all of them were very, very happy to have shared that. Though the loss is there, the loss cannot be refilled, but I think I can live with the loss now. I feel he is there. He tells, Mom, do this, better take your medicines, better do this, and I would take a great pleasure in following whatever he has. Thank you so much, Bradshaw. It's lovely having you over the thing. Okay.
Thank you so much. It makes me happy just to see that photo of him standing next to the World Stroke Congress photo. It's just it's kind of a great photo of Aashray because, as you said, he was a powerhouse of energy and knowledge, but he was very humble.
Yes.
And I think you can take credit for that. You, his parents. Because that humility came from you. And I think you required that of him when he was a young man.
Nice, very nice. Huh? Thank you so much. Just Murthy is just coming out to say hello. Okay, bye. Thanks.
Good morning, Dr. Bradshaw.
Good morning.
We'll just be starting in 10 minutes.
Yeah. I didn't want to take the chance of coming late, so I came a little early.
That's fine. Thank you so much.
You're welcome. Is it all right if I drink water? I can turn off my video and drink water, but I am here, okay?
Yes, thank you.
Stop shifting this, then they will not able to see this one. They will see this one. I'll call you. Call me to. I should also have my copy.
We're about to begin the proceedings for the evening. We're about to begin the proceedings for the evening. It is my honor to stand before you all today as we gather to celebrate the life and legacy of Dr. Aashrai Gudlavalleti. I now request Professor G.V.S. Murthy to kindly join me in welcoming our guests for the evening.
Thank you, Sarah. It's actually a pleasure to have all old friends, relatives, senior professionals all join in today. And a warm welcome to all of you and thanking you for being here at a very emotional moment in our lives. If I look back to exactly a year ago, it was around this time at 8:40 a.m. US Eastern Time, which is about 10 past 6 in the evening here in India, that the life support systems were removed. And Aashrai breathed his last assisted breathing. And therefore, we felt that having the event today would actually commemorate his life and his legacy in a very strong manner, which is why we chose the 12th. And I thank all of you who have been kind enough to join us for this evening. We would not want to wait till the others join, so whenever others join, they will join in. But we would like to be as punctual as possible, because Aashray was a very systematic, punctual person. And if the team can have the YouTube on so that everybody is logged in. I'd like to first invite Sri Govind Harigaru, who is the president of Brasho Foundation, to join us on the chair's dais. Govind Harigaru, please. And I request a bouquet to be given to Govind Harigaru. Please sit there, sir. So you can also see the screen. Thank you, sir. I next request our chief guest for the evening, Dr. Subhash Kaur, Professor Subhash Kaur, to kindly come onto the dais. Next, I request Dr. Shashank Khalid, who's come all the way from Delhi to be a guest of honor and somebody who knew Aashray as a child. I next request Dr. V. Rama Taraknath, who is the founder of the Amravati Hospitals and a professor of neurology and the chair of the awards committee, to kindly join us. I now have the honor of inviting the award winner for this year of the Aashray Memorial Award, Dr. Jonas Sundar Kumar. Please, sir, if you could just join there. On the other planet, if I could call that, is Dr. Deborah Bradshaw. There were three women in Aashray's life. The first was his mother, Vishala, who was part of his journey during his formative years. Then came Dr. Deborah Bradshaw, who's online, joined us from Syracuse, who was the program director and a mentor for Aashray, a bonding that he developed for her, that whenever he used to be in India, was always talking about Dr. Bradshaw. And what we would do, Dr. Bradshaw, is to give you a bouquet virtually, because we can't do it in person.
Wonderful, thank you.
So this is what we could do, Dr. Bradshaw, to honor the bonding that Aashray had with you. The third woman in Aashray's life was Anusha, our beloved daughter-in-law and the love of his life, a couple who understood each other very well, got on fantastically, had very similar interests, and shaped the later part of his life after he got married over the last 6.5 years. So the three women are the women who actually saw to it that Aashray developed into who he was over the course of his 35 years of life on this planet. I request those who are physically present here to kindly honor Aashray with flowers. If all of you could just come in there. Dr. Jagannath, if you could also join. Dr. Vishala, Dr. Usha, and the others. Help. You can light that lamp there. Help in lighting. Lights.
This is your side.
Yeah, my name is there. Put it into slide. Show more. Just to introduce the people on the dais, Sri R. Govindhari Garu, who is the president of Prasho. He is the founder of the Pushpagiri Vitro-Retina Institute, which is a not-for-profit NABH accredited NGOI hospital chain, both in Telangana and Andhra Pradesh. He is a veteran development strategist and social entrepreneur with a long innings of contribution to society. He has a leadership role in many educational institutions, including the Bharatiya Vidya Bhavan's Manchi Revula School and the Rajaji International Institute of Public Affairs and Administration. He has been a board member at the Tirumala Tirupati Devasthanams, Dharma Prachara Parishad, the University of Higher Vedic Studies, amongst other religious and spiritual bodies in the country. And many of you would have seen in the papers that there was gold plating, the Vimana Gopuram of the Narasimha Swami temple at Yadgiri Gutta. So he was the architect behind making that happen. Welcome, sir. Thank you for giving us time. Professor Subhash Kaul, a neurologist of eminence, completed his DM Neurology from the PGI Chandigarh, and Dr. Jagannath also is here from PGI innings. He did his stroke fellowship at the NIH Maryland, and then was faculty for a long duration at the Nizam's Institute of Medical Sciences for 27 illustrious years, where in addition to being the professor, he was also the dean at NIMS. He's currently working as a senior consultant at KIMS, Sikandrabad, serves as the chairperson of the Research Advisory Board, KIMS Foundation and Research Center, a humongous number of publications in international peer-reviewed journals, PI of the Hyderabad Stroke Registry, and was awarded the State Teacher Award by the government of Telangana just about 7 years ago. Past president of a number of professional organizations, including the AP Neuroscientists Association, the Indian Stroke Association, and Indian Academy of Neurology. Professor Shashank Kale, with whom I have a very long association, right from the time when Vishala got operated. He was there with us at that time, an alumnus of the Maulana Azad Medical School in Delhi, and completed his specialization in neurosurgery from AIIMS Delhi, and has continued to work there and has come through the ranks to be the head of the Department of Neurosurgery. He is also the officer in charge of the Gamma Knife Center at AIIMS, a globally acclaimed spine surgeon who has contributed to many innovations with special interest in craniovertebral junction, published more than 200 papers, and has a keen interest in cell and molecular biology in addition to clinical practice. Welcome, Dr. Kale. Professor Deborah Bradshaw, thank you, madam, for joining us, who completed her internal medicine from the University Hospital Sani Health Science Center, Syracuse, and then later a MD in neurology from the Boston University Medical Center. Then went to do a fellowship in clinical neurology and electromyography from the Lahey Clinical Medical Center, UMass, and has been associated with the neurology department at SUNY Upstate since 1990. A clinical professor of neurology, is a residency program director at SUNY Upstate Neurological Institute till last year when she stepped down as the program director, a member of the American Academy of Neurology and American Association of Electrodiagnostic Medicine, has numerous path-breaking publications to her credit, and some of those were really very, very heart-touching, looking at gender and equity issues, which is very rare in today's world in a specialized field like neurology. She was Aashrai's mentor. She meant so much to him, and that is why, on our request, Dr. Bradshaw has been able to give us some time today to join us for an hour this morning to talk to us about Aashrai. Thank you, madam, for joining us. Dr. Rama Taraknath, he is an alumna of the Government Medical College, Guntur, completed his neurology from the GB Pant Hospital in the Maulana Azad complex in Delhi, and is an emeritus professor of neurology at the NTR University of Health Sciences. Currently is head of the Department of Neurology at Lalita Super Speciality Hospital, founder of the Amravati Institute of Health Sciences, where he heads the Department of Neurology, formerly professor and head of the Department of Neurology at the Government Medical College, a keen academician with many publications to his credit, and is the chair of the Aashrai Gudlavalleti Memorial Award Committee. Welcome, Dr. Tarak. He is also our classmate and a close friend. Thank you for being here. Professor Jonas Sugandhan Sundar Kumar, an alumna of the Christian Medical College, Vellore, currently heading the Center for Brain Research at the Indian Institute of Science at Bengaluru, an avid researcher who is contributing immensely to neurosciences in India, a leading path-breaking work on dementia and one of the biggest cohorts on dementia in India, which is going to add a lot of value to how the elderly care is going to be practiced in this country. He is the first recipient of the Dr. Aashrai Gudlavalleti Memorial Award in Neurosciences. Dr. Rama Taraknath will give a more detailed sketch of Professor Jonas later. Welcome, Dr. Jonas. Thank you very much for being here with us. I now hand over to Sarah.
To honor the memory of Dr. Aashrai, I now request everyone to stand and observe 2 minutes silence in his honor. Thank you. I now request Dr. Anirudh, Dr. Aashrai's beloved brother and our Director of Public Health, to introduce Dr. Aashrai.
Good evening, everyone. So my presentation is just a montage of Aashrai's life through different pictures that we collected over the years. The time we spent together as a family, as a brother. So firstly, welcome. Today is a momentous occasion as we gather here to honor his memory. And it's also the first time that I'm probably speaking on a public platform about Aashrai. So he cackled and cried into this world on the 18th of February, 1989. But this journey was tragically cut short on the 12th of March, 2024 at Columbus, Ohio, in an operation theater, pretty unexpectedly. But his love and legacy have left an indelible mark on the field of neurology, in the lives of his family, friends, and most important, his patients. He was always a troublesome brother. You will hear a lot of good things about him today, but probably after Anusha, I would have been probably the only other person on the planet who would have seen the negative or the wicked side of him. He would fight hard. He would ensure he won everything by cheating. There was absolutely no way he would lose any game. Even if 10 people saw he was out, no. But in his heart, he loved hardest. When he would support you, when he would back you, he would go to any extent. He would ensure you see the correct path of doing things, of achieving something. From a young child who had an answer to all queries, believe me, every single query. To a youth who wanted to be a neurologist, he always exhibited insatiable curiosity. It could be about anything, especially music. And thus, he found and did everything passionately. I cannot remember him doing anything dispassionate. If he didn't like it, he would not do it. Be it maths, be it French, that he... Not a lot of people know he used to speak French. He learned French because he enjoyed doing it, not because somebody else told him to. He was always very quick-witted, always had a really sassy reply, ready for an argument or a debate, as he would call it, because he would always have to win. Loved reading, assimilating knowledge, and disseminating it amongst his family and peers. His quest to become a neurologist was to ensure nobody would face the turmoils that our mother faced. And that gave his chaotic scientific mind an iron-built focus. Up till then, the naughty, the bratty Aashrai that we knew transformed into the ideal child or the ideal representative, the Sharma ji ka beta that we all would want to be, we would aspire to be. Thanks to that, he was able to study his medicine at the Kilpauk Medical College in Chennai, where he spent a lot of time with his grandparents, my cousin brothers, aunt and uncle. I've tried to capture through these montage of images here. Then went on to study or complete his residency in neurology under Dr. Bradshaw's leadership at Syracuse, sunny upstate university. But his mind was always on the lookout for the next scientific conquest. What should I do next? So he decided he should go to Washington next, complete his fellowship in stroke. And then somehow he finally decided, okay, I should start working in Ohio for some time. That's exactly what he did. Even then, his mind was constantly looking for new avenues. And this journey led him to pursue his MSc in epidemiology from the London School of Hygiene, where he was awarded a distinction, albeit posthumously. His dedication to the cause was unwavering, and in 2022, at the American Academy of Neurology's annual meeting, he presented his findings on the white matter involvement in SPG 76, a retrospective MRI analysis of 11 cases. Professional celebrations aside, he personally decided that it was time to tie the knot with beloved Anusha, pediatrician currently training as a pediatric cardiologist at Ann Arbor in Michigan, and spent some lovely time with her during the 6 years that they were together. Aashrai was a compassionate healer who loved his patients so much that many of them left messages of kindness, of love, and asked their children to ensure his messages reached to us even when they had passed on. Some of them, unfortunately, reached us on the day of his funeral. Yeah. So these were some times that he spent in the US with his friends, and I'll let the slideshow be. His innate sense of social responsibility drove him to serve his patients with unparalleled dedication. I've never heard such high testimonies being shared by patients before for anybody else. Unfortunately, or rather fortunately, he was a loving son, a kind husband, and a remarkable brother in many ways. And in this endeavor to recognize and to ensure that his legacy carries on, Prasho Foundation has established the Dr. Aashrai Sai Venkat Gudlavalleti Memorial Award, which will be an annual award honoring his legacy by presenting this award to one Indian neurologist each year. There are a lot of things to learn from Aashrai. Above all, his dedication, compassion, pursuit, and excellence, not only neurology, but humanity as well. Thank you.
Thank you, Anirudh. I'll just give a very brief description of the Memorial Award before I hand over to our president. We were looking at closing the loop. Dr. Bradshaw started it because she realized that he was one of the best students that she had, residents that she had, who believed very strongly in quality improvement. And the duration that he spent at Syracuse, he kept getting that award or getting recognized for quality improvement. And the first award that was instituted in Aashrai's name was by Dr. Bradshaw for quality improvement, best resident at Syracuse, sunny upstate. Then we reached out to the school because we wanted to close the loop. So we went out to the high school where he studied, the Mothers International School of the Aurobindo Ashram at New Delhi. And they then instituted an award for the best class 10 student in science in the Mothers International School. We then wanted to do something at the college where he studied, the medical school that he went to, that was Kilpauk Medical College. And with the help of friends like Dr. Hashim, we were able to reach out to the Alumni Association of Kilpauk Medical College, who have now instituted the best outgoing student across the 14 subjects in medical school in Aashrai's name every year starting from July this year. And this, we felt, was the next part of that journey, is to institute an award for professional achievement in the field of neurosciences, not limited to neurology, but looking at all domains of neurosciences. It was neurosurgery, nanotechnology in neurology, neurology, or any other branch, lab, clinical, or population-based. Aashrai had a passion for neuroepidemiology and neuroinfectious diseases. In fact, in August last year, he was to take up at St. Lucia the neuroinfectious disease position. But unfortunately, that was not to be. But what led us to think about this award is, how do we keep that legacy of a young man, 35 years old, who already had 30 publications and large number of presentations, and like Anirudh just described, had certain characteristics which are very different. So his uncles, aunts with whom he grew up in Chennai, he never wanted to go to the hostel. Always, that's the reason why he chose Kilpauk, because Madras Medical College and Stanley Medical College were too far from where they stayed, and he would have had to stay in a hostel. So I'm not going to stay in a hostel. Stayed with his grandparents. Whenever there was an IPL match and they would buy tickets, he would refuse to go. He'd say, I have charted out these 10 pages to study tonight. I would not do anything else today. When we went to his apartment in Ohio, the tables were littered with books, stats on one side, neurology on one side, pages opened or dog marked, because he had a schedule, because he had that thing of doing everything systematically as per schedule. That was what drove us to look at recognizing that sort of scientific temperament and achievements at a young age, which is why we said, let us have an award which recognizes the contributions at a young age, below the age of 45 years, because when you look at a super specialty, by the time meaningful research is done, you would already be 40 years and above. And therefore we looked at young in this sense being 45 years old, or young for that matter, and that is how this award started. Every year it will be recognizing one authority who has contributed or whose work will contribute to differences in the way people live their lives, specifically in relation to elderly care. That is the genesis of the award. We've had goodwill from all of you, which is how we started this particular award. And we look forward to continued goodwill as we embark on this journey and continue to work going forward on this journey. So that is about the award, and I would now request Mr. Govindhari Garu, as the president of Prasho as well as the presiding officer for today, to give a brief address before we move on. Govindhari Garu.
Thank you, GVS. Ladies and gentlemen, esteemed guests and distinguished members of Gudlavalleti family. It's with great honor and humility I am standing before you today to commemorate the life and legacy of Dr. Aashrai, a brilliant neurologist whose passion in the field of neuroscience continue to inspire all of us. The creation of this Dr. Aashrai Gudlavalleti Memorial Award, established by the family, is a testament to the indelible mark Dr. Aashrai has left on all of us. His passion for advancing research in neurosciences and his unwavering commitment in improving the quality of life for the elderly through holistic and compassionate approach. He stood as a beacon of light for all of us, guiding our efforts to create a better future in healthcare. Dr. Aashrai's dedication to understanding the complexities of the human brain, his pursuit of innovative treatment protocols, and his compassionate approach to elderly care especially have transformed the lives of so many people. He was not only a practicing neurologist in the United States of America, but also a visionary who sought to bridge the gap between scientific research and practical patient-centered care all his lifetime. It's our duty to build his legacy so that his work, the values which he cared and practiced in his life, care for the elderly and compassion. It is my privilege to invite all of you here who have gathered to celebrate the first ever Dr. Aashrai Gudlavalleti's Memorial Award. I also would like to congratulate Dr. Jonas Sundar Kumar, a distinguished individual whose work aligns so closely with Dr. Aashrai's life, vision in advancing both scientific discovery and patient-centered care. This award is a continuing legacy made possible through the generous love and support of the entire Gudlavalleti family and of course on behalf of Prasho Foundation. I wish to extend my full support to this initiative in taking Aashrai's legacy forward year after year for many more years. The family's commitment To honor Dr. Aashrai's life work ensures that this award will inspire and uplift future leaders in the field of neuroscience for years to come. It will encourage researchers and healthcare professionals across the globe on the critical intersection of research, patient care, and support for the elderly. As we move forward, let us remember that Dr. Aashrai, life is not defined by what he did alone, but by the profound impact he had left on each individual he met across and he spoke in his lifetime. His legacy lives on every mind inspired, in every patient he helped, and in every new researcher and clinician who strives to carry their work forward. Let's all strive as much as possible to live by his example, a committed individual, a passionate clinician, a dedicated researcher, and a commitment to care and a relentless pursuit of knowledge for the betterment of humanity. Once again, congratulations to Dr. Jonas, the first recipient of Dr. Aashrai Gudlavalleti Memorial Award. And thank you to Gudlavalleti family and Prasho Foundation, of course, for making this moment possible. May we all continue to honor Dr. Aashrai's memory by advancing the work he so deeply loved and lived his entire life. Thank you very much.
Thank you so much, sir. Before I go on to Dr. Bradshaw, I started off mentioning the three women in his life who made a big difference. Aashrai, in addition to his professional pursuits, also had an interest in music. He completed his graduation in music while still in school and was an avid tabla player. He was inspired by Sri Zakir Hussain Ji, the late Zakir Hussain Ji, and it is poignant to see that both of them passed away the same year. The maestro and the person who followed his music so closely. He also had a spiritual inclination and used to read chapters from the Gita, from the Dharmapada, which he used to follow very closely, and he used to underline bits and pieces of that. The credit for allowing that to happen has to go to our beloved daughter-in-law Anusha. When we met her last, she mentioned that there was one thing I would never come in his way, and that was his interest and pursuit of spirituality. I never came in his way or never stopped him from doing that. We never recognized that because he had moved on in life and was with Anusha. But that was again something which told us many facets of his life. We never ever got to know when he won any prize in school, because he never come and share that. It would be somebody else in the school who will come home and say, Aashrai won this award, the most punctual person. He always had 100% attendance at school. Never skipped school, excepting when he was very sick. So he would win a lot of prizes which would never come to know about. And Dr. Amitesh, who of course was Dr. Kale's student, he was here for the rituals for Aashrai, and he mentioned that he was doing some programs with the John Hopkins School which we did not know about. Maybe Anusha knew about it, but not us. So he was that sort of a man, never wanted to tom-tom his achievements. And that is why I think the relationship of a mentor-mentee that Aashrai had with Dr. Bradshaw is so commendable, because he just used to talk about her. Whenever he'd go back, he'd say, no, I have to take a gift for her. That was the sort of level of understanding between the two of them. So it is a pleasure for me, Madam Dr. Bradshaw, to request you to share some sentences, some words on Aashrai and the quality improvement certification rewarding process, and also why you feel that exposure to research during the residency period is critical in overall development. So can I hand over to you, Dr. Bradshaw? Please, can you just connect, Madam?
Thank you so much. Can you hear me well?
Yes, ma'am, we can hear you. Yes, ma'am, we can hear you.
Thank you. Thank you, Dr. Morsi, for inviting me to attend this ceremony as a guest and to say a few words about our beloved Aashrai. Greetings and thank you to Dr. Gudlavalleti, Aashrai's mother, Dr. Anirudh Gawan, Aashrai's brother. Greetings and thanks to Aashrai's widow, Anushka Kundro, and greetings to many distinguished guests gathered here. Also, thank you, Dr. Murthy and the Bradshaw Institute for establishing this award to recognize Aashrai's extraordinary accomplishments and to encourage others on his same path. Finally, warm congratulations to Dr. Jonas, the inaugural awardee. I was Aashrai's neurology program director in the United States. We were very fortunate to match with Aashrai, and he was a standout resident from the very beginning. Everyone recognized immediately that he was knowledgeable, he was efficient, he was dedicated, and yet despite his really extraordinary knowledge base, he was kind and humble. And I was saying to his mother at the beginning of this talk that credit in particular goes to her and Aashrai's father, that you required that humility of him, and that allowed him to serve so much better when he came into his own. He was clinically astute at the bedside, but he also prioritized research and quality improvement. He won numerous awards during residency, including the Scholarship Award for his class each of the 3 years, and the Professionalism Award during his PGY 3-year. He presented numerous abstracts at national meetings, and he co-authored 14 peer-reviewed articles while he was still a trainee, which is quite extraordinary. Importantly, he was elected to the Alpha Omega Alpha Medical Honor Society. He was nominated by our medical students, and this is an exceptional honor in the U.S. medical system, something that comes to very few. Aashrai was very interested from the beginning in quality improvement, and recognizing this, we named him our inaugural quality lead during his final year of training, where all the senior residents take a leadership role. He took this task very seriously, and he wrote a multiple-page summary of his action plan for his work as quality lead to shepherd the residents and their QI projects throughout the year, and he followed through on it. He set the bar very high for future quality leaders in the residency program. The science of quality improvement is a systematic, data-driven approach to analyze and enhance the performance of systems and processes, aiming to achieve better patient outcomes and improve overall efficiency in medical care. Physicians are not merely practitioners of medical science. We're positioned to recognize its limitations and to push those limits back on behalf of our patients. The ACGME, which is the body accrediting residency programs in the US and increasingly abroad, has a program requirement that states the following. Medicine is both an art and a science. The physician is a humanistic science who cares for patients. This requires the ability to think critically, evaluate the literature, appropriately assimilate new knowledge, and practice lifelong learning. Studies have shown that residents who received research training have a greater appreciation for evidence-based medicine and better clinical competency scores. The Dr. Aashrai Sai Venkat Gudlavalleti Memorial Award in Neurological Sciences recognizes young scientists who, like Aashrai, devote their hearts and their minds to improving patients' lives through science. This is an important way to keep Aashrai and all he stood for alive. Thank you again to Aashrai's family, who have begun to feel like my own, and warm congratulations again to Dr. Jonas for receiving this honor.
Thank you so much, Dr. Bradshaw. It was awe-inspiring to hear about Aashrai from you, because after he grew up, spending 4 years under your mentorship, that was the growth phase of his life in a professional manner. And I don't think he missed the maternal instincts in Syracuse because of your presence. Thank you very much for taking care of him, for all of us, and we'll always remain indebted to you. And thank you for joining. And if you are able to stay for some more time, you may be able to listen to Dr. Jonas presenting the oration. Thank you, madam. I now request Dr. Taraknath to kindly introduce the awardee for this year, Dr. Jonas. So over to you, Dr. Taraknath.
Good evening, the dignitaries on the dais, ladies and gentlemen. It is a great pleasure to introduce Dr. Jonas Sukandan Sundarakumar, who is an upcoming and a brilliant neuroscientist of our country. At present, he is working as an assistant professor in Center for Brain Research in the Indian Institute of Sciences, Bangalore. He graduated from the prestigious CMC College, Medical College, Vellore, where subsequently he did his DPM2. And then he went to the UK to complete his MRCP Psychiatry and came back and completed his DNB Psychiatry in India. He was the recipient of Lundbeck Academic Excellence Award and Gold Medal for the best outgoing postgraduate student in the institution of DNB, where he completed it. After his completion, he did a short stint in ISRO and VK Hospital, Chennai. He could have gone anywhere in the world and gone into practice, lucrative practice, but he had a penchant for research. So that led him to take up a job as a research psychiatrist in the Indian Institute of Sciences, Bangalore, in the Center for Brain Research. He published over 30 PubMed indexed papers, including high-impact publications in Nature, Lancet, and the BMJ. A paper titled Changing Demography and the Challenge of Dementia in India, co-authored with an eminent neuroscientist, Padma Shri Dr. Vijayalakshmi Ravindranath, as the founding director of the Center for Brain Research, and published it in Nature Reviews Neurology, which has an impact factor of 44.7, highlights the rapidly growing incidence of and prevalence of dementia in India and proposes community-based multimodal early interventions to prevent or postpone dementia. He has received several awards and fellowships for his research contributions, and he presented his work in various national and international scientific meetings. He has more than 45 publications in various national and international journals, apart from the several invited talks and platform presentations which he did in various conferences. Of the several applications that we received, we selected Dr. Jonas as the first recipient, or first Aashrai Memorial Award as the first recipient. Now, ladies and gentlemen, please join me in welcoming Dr. Jonas.
Respected dignitaries, loving members of the Dr. Aashrai Gudlavalleti family, esteemed professionals, and dear friends, it's truly an honor to be here, and I'm deeply humbled by this privilege that I've received to deliver the Dr. Aashrai Gudlavalleti Memorial Oration. I would like to express my sincere thanks to the Gudlavalleti family, the Prasho Foundation, and the selection committee for conferring me this award. As people mentioned earlier, this is definitely an inspiration for me to press on harder to the kind of research work which I'm doing, which aligns very closely with what Dr. Aashrai was carrying out. And hopefully in the coming years, the insights from this research will lead to reducing the burden of a very important neurological condition called dementia, which is rapidly escalating in India and globally. So with those few words, I would like to proceed with today's talk entitled Identifying Dementia Risk Factors in Rural Aging Indians, the CBR SANSCOG study. So firstly, greetings from the Center for Brain Research at the Indian Institute of Science. The CBR is a mission-oriented center with converging disciplines of clinicians, molecular neuroscientists, computational geneticists, and bioinformatics experts, all of whom work together for one unified goal: to decode brain aging and thereby reduce the burden of neurodegenerative disorders like dementia, particularly in our country. The CBR is fortunate to be supported by the Pratiksha Trust, and we had the privilege of having our foundation stone and the inauguration by our Honorable Prime Minister. And it's 10 years since CBR came into existence, and we are still pressing on to bring out meaningful translational research discoveries towards reducing neurodegenerative disorders in India. I'd start with some acknowledgements. Typically, speakers put this at the end, but I think it's very important to start with the acknowledgements because the research which I'm involved in is definitely a huge team effort, like I mentioned, by several people at the Center for Brain Research. So I would like to specifically acknowledge the CBR SANSCOG study team, a wonderful team of about 35 people who are based in a rural site in Kolar district in Srinivaspura, who have been working tirelessly since 2018 to recruit over 10,000 participants into this large rural cohort. I would also like to place my acknowledgements to the CBR clinical team a team of doctors, psychologists, alternative medicine physicians, public health experts, and project managers. My special thanks to the other faculty at CBR who have enabled us to work as a team and have contributed to their different experts in their different expert fields. And last but not the least, the young minds, the students, research assistants, and postdocs in the lab who always keep us thinking and keep our curiosity going. So to give a brief introduction as to why this particular field of dementia research is relevant, particularly in a country like India. If you can see in the graph, at around the time of our independence, the average life expectancy of a person at birth was 32 years. Around 50 years later, in around 2000, it doubled to almost 62 years. Right now in 2025, it's about 70 years. And by 2100, it is expected that people will live to about 82 years on an average in India. So our life expectancy, thanks to the modern technological and healthcare advancements, has gone up drastically. On the other hand, our fertility rates, birth rates are dropping, which essentially means that the demographic characteristics of our country is rapidly changing. If you have a look at this graph, a kind of a pyramid which shows the bottom areas to represent the younger age groups and the top peaks to represent the older age groups, we can see what a dramatic transition has been happening as the younger population keeps decreasing and the proportion of older people in India is increasing at a rapid pace. To put this in perspective, in about 25 years, 1 in 5 people, roughly 20% of our population, will be above the age of 60. So, with the increase in the older population, the challenge of aging-related neurodegenerative disorders also becomes a challenge. And as you can see, worldwide, the prevalence of dementia is increasing. Particularly, I would like to draw your attention to the second graph, which shows how this proportion of increase in dementia cases is rather disproportionately affecting low and middle income countries like India. And actually about 2/3 of people with dementia live in low income countries led by India, China, and others. But sadly, if you look at the proportion of research which happens in India, only a fraction, less than 10% of the research on dementia is from these low and middle income countries. And there was a projection in 2020 that by 2030, we would have 7.6 million people with dementia living in India. Sadly, in 2023, these estimates were revised, and we had already crossed the mark with about 8.8 million people with dementia in India. And by 2050, this number is going to exponentially increase to around 14-15 million. So that gives us a picture of how significant this problem is and how this can pose as a very significant public health issue in the years to come if not addressed appropriately. So with this background, the research which I'm involved in at the Center for Brain Research primarily revolves around asking questions like, how can we preserve healthy memory functions during aging? How can we identify risk factors for abnormal memory loss and disorders like dementia? And how can we prevent, postpone, or reduce the burden of dementia, particularly in India? Now, fortunately, we know that dementia, even though it is a chronic, incurable, progressive disorder, the risk factors for dementia, if identified early on, can make a change in either preventing or mitigating the course of the disorder. And this research can be possible only by carrying out large-scale, longitudinal, community-based studies on the aging population. And so far, such large-scale studies, particularly in the rural community-based population where 2/3 of India live, are very scarce. And with that in mind, the SANSCOG study, which stands for Srinivaspura, Aging, Neurosenescence and Cognition Study, was started in 2018, and it is the first of its kind large-scale prospective aging cohort study in India. Now, a little bit of introduction about what is dementia, how is it different from age-related cognitive decline. Now, as we know, some amount of cognitive decline or deterioration is expected with aging and is in fact normal, but not all our cognitive abilities decrease with age. Certain abilities like the processing speed, complex attention, which means paying attention to multiple stimuli, visual, auditory, other distracting stimuli at the same time. So complex attention, episodic memory, source memory. Sometimes all of us would have faced this scenario where we know a fact, but then it's very difficult to recall where exactly we got that fact from. So that's called a source memory. Mental flexibility and executive functioning can decrease with age. However, certain faculties like our vocabulary, crystallized intelligence, the procedural memory, semantic memory, memory about facts, and knowledge-based memory can remain relatively stable. So this is known as normal cognitive aging, or it's called by other names like age-associated memory impairment, age-related cognitive decline, etc. So how is this different from dementia? Now, dementia is a common word used for a clinical syndrome or a cluster of signs and symptoms, which is usually progressive and irreversible and involves a disturbance of multiple cortical functions like memory, the judgment, reasoning, thinking and logical ability, problem solving, etc. And very importantly, these disturbances should be severe enough to impair a person's day-to-day functioning. And it's important to realize that dementia is not a part of aging, nor an exaggerated form of aging. Dementia is a specific group of disorders. I think most of us would be familiar with the term Alzheimer's disease, which in fact is the most common type of dementia. So, dementia was actually described over 100 years back by Dr. Alois Alzheimer, and his patient, Auguste Dieter, was actually the first patient in whom he described the clinical symptoms of Alzheimer's disease. So if you can see, there are certain characteristic changes in the brain which happen when people have Alzheimer's disease or dementia. There are these abnormal proteins, misfolded proteins which get deposited in the brain. There is a protein called beta amyloid. There's another protein called tau. These proteins can get abnormally misfolded and get deposited in the brain, which then can cause compromise in the nerve cell structure, leading to nerve cell death, and then its implications of cognitive decline. If you can see in this picture, now we have made substantial progress in the diagnosis of dementia, where we have modern diagnostic imaging technologies which can specifically tell you how much of amyloid protein, the beta amyloid protein, is deposited in the brain. If you can see the first picture, the red areas, the bright red areas, show the areas where there is amyloid deposition, and the scan below shows a tau PET imaging methodology, which again shows this abnormal deposition of tau, as compared to the scans on the right, where you see cognitively normal individuals. So over the last several years, since dementia was first described, we have made a lot of progress. In summary, we have understood the disease, we have understood what pathology is involved in the disease, what is the potential genetic mechanisms involved in the disease. But however, till date, there is no definitive cure for dementia. So the focus now shifts on, rather than understanding the disease, which we have done pretty well, to see what actually causes the disease, and then how early can we detect this disease. And if we can detect some risk factors or red flags as early as possible, then can we change the course, prevent dementia, or at least postpone or reduce this progressive course. So if you can see this graph, it shows the extreme end shows dementia. The first graph shows the normal cognitive decline, which can happen with aging. Then the second graph with the dotted line shows how accelerated cognitive decline can happen with dementia. But then I would like to point out to this phase called pre-dementia or preclinical stages. So basically what preclinical means is that before a person can have any signs or symptoms which a clinician can diagnose, there's a lot of things happening in the brain, some sort of pathology which is going on. And if you can see here, recent research has shown that these preclinical stages, in these preclinical stages, the actual disease process starts about 20 to 30 years before any clinical symptoms can be seen. So by the time a person develops dementia at around 65 years, already 20 to 30 years have already passed, during which these pathological changes have happened. So what we are focusing on is, if we can focus on these pre-dementia or preclinical stages to understand why some people develop dementia, why some people on the other hand are able to preserve their cognitive functions even despite aging, then we will get clues to put in strategies, intervention strategies, timely strategies to prevent or postpone dementia. Added to this layer of complexity, this is the image which I showed you. The right image showing bright red areas where there is abnormal amyloid protein deposition, and then the left image showing a person who's cognitively normal. I'm not sure if you noticed in the previous picture there was a question mark. This actually is also a scan of a person who is cognitively normal. And as you can see, the middle image, there is still a lot of amyloid deposition. There are bright red areas, but still the person functionally is able to preserve their memory functions. So this brings us to another question, that there are people who, despite having characteristic disease features of Alzheimer's in the brain, are still able to function normally and preserve their memory functions. So this leads to another complexity to try and identify what are the potential factors which can confer what we call as a resilience to pathological changes, a resilience to an underlying, maybe a genetic vulnerability. And hence this becomes important to also study not just the risk factors, but also the potential protective factors to preserve healthy cognitive functions. Now, like I mentioned, much of this research evidence is from other populations, Western Caucasian-based populations. But however, we all know that there are very unique risk factors in India. For example, like I mentioned about the rapidly changing demographic scenario, a lot of social changes happening, joint families moving on to nuclear families. India, particularly in the rural areas, has risk factors like malnutrition, low education, multilingualism, again, another unique, I would say, a rather unique factor in India where a lot of people here, including me, speak more than one language. our particular socio-cultural and genetic diversity. So considering all these factors, it's very important that the research should be focused on the Indian population to identify population-specific risk factors and protective factors. So with this in mind, the CBR SANSCOG cohort was started as a community-based cohort of aging persons. We recruit people who are above 45 years of age without dementia, because like I mentioned, we want to see what happens 20, 30 years before a person starts to manifest the clinical symptoms. And we study the diverse cognitive trajectories of aging. And this will help us identify risk factors, protective factors, and also try and develop a sort of a multimodal biomarker which can help us detect dementia at the preclinical or the pre-dementia stages itself. So these people recruited into the CBR SANSCOG study undergo extensive clinical, cognitive, biochemical, genetic studies, MRI scans and neuroimaging studies, and they are followed up periodically over a very long period of time. So that's where the longitudinal component of this study helps, because we want to see if as we follow up these people once in every 2 years or 3 years, how is their cognition changing? How is it varying? And then what are the potential factors contributing to these changes? We have a unique recruitment strategy because it's conducted in the rural areas. We partner very much with the local community, with the Aashrai workers who are the local healthcare workers, to develop bridges to the community and make sure that this cohort is with us through these retention strategies. So this actually, we have a center which is based in this rural project site in Srinivaspura, where all these participants undergo their cognitive and clinical examinations, and then a part of the cohort is brought all the way to the Center for Brain Research at the IISc campus, where advanced investigations like MRI, optical coherence tomography, and other specialized assessments are conducted. We've recently also realized that since this is a huge number and we are dealing with elderly people, it's very important that their mobility issues should be taken into considerations, and I mentioned recently we have started certain specialized assessments, like we have a CT scan of the brain. Now we can have a scan of the back part of the eye called the retina, called an OCT, an optical coherence tomogram, which can potentially give some clues to what is happening in the brain, because the optic nerve is actually an extension of the brain. We've also had recent investigations to look at the cardiovascular functions, how that can affect brain functions, lung functions, particularly in rural areas. We know that there is still a significant proportion who uses solid fuels, biogas fuels, biomass fuels. So can that affect cognition? We're also looking at non-cognitive markers, which means even without administering cognitive tests, we can look at certain things like the way a person walks to see if that can give any subtle clues. And there is research evidence which shows that these very minor changes in walking patterns, which may not be noticeable to others, can give clues that there is some brain pathology related to dementia which is already started in the brain. Of course, we have very detailed cognitive assessments. Now, the challenge when it comes to cognitive assessments, particularly in the rural population, because, like I mentioned, these people are predominantly low education, have lower education, and are predominantly from an agricultural community. It is very important that these cognitive tests should address their literacy levels and also their cultural factors into account. Otherwise, our cognitive tests are just going to give false positives and just label everybody as cognitively impaired just because it does not suit them. So we have gone up to very detailed extents to make these assessments specifically suited to the rural population, where it suits their language, it suits their educational level, and it is also culturally acceptable and it is easy to do. So we were very surprised that even though these are computerized assessments, we had all these assessments done on a touch screen where the participant does not need literacy to read or interpret. Rather, it's predominantly picture-based, where the participant just has to touch or press a button, and then these culturally relevant cognitive tests are very important in making an accurate assessments. I mentioned about the detailed MRI. We look at the brain structure. We look at also the brain function. We look at the brain connectivity. We also look at how the chemical compositions of the brain can change in a technique called MRS, magnetic resonance spectroscopy. All of this trying to look at how these can be potentially early biomarkers for detecting cognitive decline. We, of course, do a very detailed panel of blood investigations. And other than the environmental factors, we also look at the genetic factors. These are advanced genetic studies. We do whole genome sequencing, which basically sequences the entire human genome and then tries to find out if there are certain variants, certain genetic variants, which can actually be related to dementia and related disorders. So what are the projected outcomes? We hope that we will identify population-specific risk factors for dementia. And with this, it's important to take this knowledge forward to develop cost-effective community-level interventions which are at reach of the majority of the population in India. And this should inform public policies and will ultimately serve our goal to reducing the burden of dementia in India. So like I mentioned, the study was started in 2018. We started it off as a pilot study, and in about 1.5 years, we were able to recruit 1,000 participants. And thanks to the tireless efforts of the team, over the last 7 years, we have been able to recruit and complete the baseline assessments of 10,000 people. So there are 10,000 people in this cohort. They have been recruited from 209 villages, which are attached to 11 primary health centers. And we have also completed 4,000 follow-up assessments. Like I mentioned, this is a longitudinal study where people have to be followed up periodically till they develop dementia or till they pass away, which actually gives us the entire life course perspective of how they have aged and how differently they have aged. So I'd like to just end with a brief snapshot of some of the preliminary findings we have found. Of course, we have been able to, since we have been able to set up this large-scale study, we thought it's good to share the insights of how you set up a study protocol of conducting a large-scale community-based study in a rural population. So we have published the study protocol, which will be useful for other researchers to carry out similar studies in different parts of the country. We've also, since we have large amounts of data of cognitive assessments, of their blood tests, of other clinical parameters, this also gave us the opportunity to develop what is called as normative data. Now, what is normal should always be interpreted in terms of what population we study. For example, the height and the weight data of a Caucasian adult may not be suitable for the Indian scenario. So we've been able to publish normative data for particular Indian rural populations. During the COVID pandemic, Even though our studies were hampered, we still had the opportunity to connect with our participants, and we found that a significant proportion of our participants were affected during the COVID pandemic, because Srinivaspura is actually an area which is very famous for mango cultivation. It's one of the largest exporters of mango. And then when the COVID pandemic struck in 2020, around April, May, that was exactly the harvest season of the mango. And then, as you can see in the graph, the proportion of people who are depressed significantly rose from about 7 or 8% to about 25% during the first wave of the COVID pandemic. And you can clearly see that after the first wave, the proportion of depression decreased, and then during the second wave, it increased. Again, showing that it's not always the molecular pathology which you should be aware of. Very often, it is the social factors and the other socioeconomic factors which can contribute. We also saw that, unfortunately, due to the restrictions of the COVID, certain lifestyle-related disorders like diabetes, hypertension, dyslipidemia, and the control of these factors also worsened after the COVID pandemic. We are also partnering with an international consortium to try and see if the long-term effects of COVID affect the neurological parameters, and can that be a potential sort of a risk factor for worsening cognitive decline. We've also focused on vascular risk factors, because particularly the Indian population is more prone for metabolic abnormalities. So there is a much higher risk for cardiovascular disorders in India, and we have found how disorders like diabetes, hypertension, physical inactivity can significantly increase a person's risk for dementia. We also looked at another important social aspect, which is again of tremendous concern, as there is social isolation which is increasing. And from our study, we found that people who are having lesser social networks are at a higher risk of developing dementia. And particularly when we looked at what aspects of social networking are important, is it just the size of your network? Is it just how many people you know? We found that it's rather more than just the size. It's important to have a very diverse social network. Friends and family, other relatives, work colleagues, other volunteer groups. So having a more diverse social network is found to have a significant protective role in dementia. Similarly, we have also looked at the gender differences of how these social networks can differentially impact men and women, and how this differential risk can then manifest in cognitive impairment. Sleep is another area which we are working on, not just using questionnaire-based assessments, but also wearable devices like wrist tachygraphs, which can actually measure your physical activity, your sleep. And we have also recently acquired wearable headbands, which can actually measure the brain waves as you sleep. And then we have seen that certain specific parameters of sleep abnormalities can be associated with higher risk of dementia. I mentioned about multilingualism. We have found that people who speak more than one language in our own cohort have a protection against dementia. What I also didn't mention here is that we've also done a study on music and dementia, and we've shown that people who have engaged or participated in Carnatic music have a sort of a protection against cognitive impairment. We've also looked at certain genetic factors. There is a particular gene called the ApoE gene. Now, that is generally considered as a high risk factor, genetic risk factor for dementia in multiple populations. But surprisingly, we see that in the Indian population, this ApoE gene does not seem to have that much of an effect on conferring a risk of cognitive impairment, and rather the effect of this gene also seems to be more gender specific or sex specific. We've also looked at the disparities. Sir was mentioning about Dr. Aashrai's work on disparities, which actually are very important and often neglected. And since we also have a parallel urban cohort like this rural cohort, we had the opportunity of comparing what are these rural-urban disparities. And some of these findings are actually quite shocking, that we saw that people in the rural areas have a high proportion of undiagnosed conditions. And to give you an example, people who have abnormal cholesterol levels in the rural areas, only 1% of those people are aware that they have these conditions, which again brings us to focus that it is also important to consider these social factors which can often make a huge difference when we look at community level interventions. So some of the ongoing investigations, upcoming investigations, we're planning to look at the role of the cardiac autonomic nervous system, which is basically, I think we would have heard of the sympathetic, parasympathetic nervous system, and then how the balance of these two branches of the autonomic nervous system is very important in not just preserving our vital physiological functions like heart rate, BP, etc. It can also potentially have a connection with brain functioning as well. Like I mentioned, since we are observing certain unique protective factors, we are now developing what we call a cognitive reserve index, specifically for rural Indians and urban Indians, where we can say that you can assess yourself and see what are all these protective factors you have, where do you stand, and then what do you need to do to improve your cognitive reserve. We're also looking at developing unique cardiovascular, cerebrovascular risk scores for dementia. And since we are privileged to have a multidisciplinary team at CBR and also collaborators at other departments of IASC, we are using the latest artificial intelligence, machine learning technology to see how we can actually better predict dementia, better predict progression from a pre-dementia stage to a dementia stage. What are the factors which are involved? What are the clinical factors? What are the factors involved in the brain, in the MRI, etc.? We're also looking at, like I mentioned, a non-cognitive biomarker, which can be very useful for rural areas in India with low literacy. We're also looking at developing a multimodal frailty biomarker to predict prodromal dementia. So with that glimpse, I would like to thank all of you for your patient listening, and I would like to acknowledge the support of my family. I think it's very important. Sir was mentioning the 3 women in Dr. Aashrai's life. I think it's also important to acknowledge that their support is tremendous. There are also 3 women in my life who have, contributed tremendously. The support of my wife, the constant motivation, encouragement of my mother, and I have an elder sister who has also been with me in all the ups and downs and been a tremendous source of inspiration. So thank you once again for giving me this honor and privilege, and I would like to extend a warm invitation to all of you whenever you come to Bangalore, or please make it a point to come to Bangalore and visit us at the Center for Brain Research. We would be very happy to actually, this was a very short presentation, but we would be very happy to show you exactly what we do, how we do, and then we also invite people who are interested for further research collaborations. Thank you. Thank you once again.
Thank you, Dr. Jonas, for that fascinating talk. And it didn't make a difference whether you come from a medical background or a non-medical background. It was equally relevant for everybody. So thank you very much for making it look so simple when we know that the brain is the most complicated organ in the body. I would now request Professor Subhash Kaur, Govind Harigaru, Professor Kale, and Dr. Taruk to kindly come forward and Dr. Jonas, and I request Dr. Ranga Reddy garu also to join in for presenting the scroll. Scroll, not the shawl. Sir,
Unless somebody moves. Unless somebody moves, nobody moves.
I would request all of you to together. Sorry. Thank you very much. Now, I don't know what this is. Something slipped from there. I will now request Dr. Vishal, who has been behind the entire award idea and been one of the principal benefactors from the family, to present the check to Dr. Jonas. Yeah. Hold it straight. Hold it straight.
That's what always I feel like Aashrai wanted. And he's a noble fellow, everything. I don't want to speak about it.
So it's not just the chart, which is there's also a check here. Thank you very much.
And my very fellow Anirudh is now motivating all of us. Thank you.
Thank you. Thank you so much.
Can I now, this is quite a complicated thing, as complicated as the brain. Can I now request our chief guest, Dr. Subhash Kaul sir, to talk about the presentation, the oration, and your thoughts as the chief guest. And I'll come back to the acceptance speech at the end of the two. Please, sir.
Dr. Murthy, thank you very much, and the dignitaries in the dais, and all the dear friends. You know, some things in this life happen by some very strange coincidences. They happen in the life of all of us. I have not met Aashrai, but he's in my life. I don't know whether Dr. Murthy remembers, there was a felicitation ceremony of Dr. Mohan Das many years ago at the Necklace Road. And we knew each other, and you knew that I'm in neurology. And you told me that you'll be happy to know that my son Aashrai has been accepted for residency in USA. And why you informed me? Because he had joined neurology. And I was very happy, I congratulated you. And after that, I think 6 or 7 years later, we recently met. And you told me, Dr. Kaul, I want to inform you that Aashrai has passed away. And I just couldn't believe myself. I mean, the pain which parents can have on losing a child is impossible. I mean, the whole universe is small to accommodate that pain. But the composure with which you told me, I was just absolutely impressed with you. But the way you have converted that personal grief into a bigger purpose is laudable. You know, because ultimately at the end of it, there's pain everywhere. As doctors, we see pain everywhere. But the way you have converted it into this oration, into this legacy, and it's not a one-time oration, I think it will keep on enlarging in its scope, and year after year after year, I think I really congratulate you for making this happen and involving me into part of this. You see, finally at the end of it, as clinicians, we are just retailers. We are just dispensing. But the progress has to come from scientists. And I can share one thing with you, that medical science, we keep on telling that it has advanced and it has, but there are still significant limitations. I think we hardly have a cure for anything. And 2-3 subjects are very dear to me because I see it every day, in which there is a lot of need for research. One is acute critical care, because critical care is something for which nobody is prepared. Suddenly a man gets a massive stroke, and suddenly he's alone in the whole world. And this is not something for which the family has prepared financially or emotionally or anyway. Suddenly he lands into the ICU. And then I talk to the family and all, for which they are not ready at all. His son is not ready, his wife is not ready, his old father is not ready. And we as doctors, even though we say, neurosurgeon is sitting here, that we are doing a lot, but there are huge limitations. We say, have you counseled the family? As if that is the end of it. Counseling the family is not the solution. Solution is to save that man, to give him into a meaningful existence. So I think there is a lot of need for that research, and that is one. Second thing which is important is the predictive models. I think we need to have predictive models. We don't know when we do a particular procedure, will it succeed or not? We just don't know. And what the doctors have found the easy way out. You tell the patient or his family, you decide whether you want to do it or not. You know, there is a problem with you, there is a tumor in the brain, I will take it out. But after that what happens, I also don't know. You decide. I mean, if the doctor doesn't know, after 20 years of training or 30 years of training, how do you expect that person to know? So no, that is your luck, you decide. So I think this is also something which troubles us a lot. And in this, I have also committed mistakes personally. You know, when a patient has asked me, I remember there was a dancer, she said that she had to do one of her vessels was blocked. She was a famous dancer, you may be knowing her name also. But vessels were blocked and that vessel needed to be opened. And she came to me with full confidence. The doctor, they are asking me to open the vessel. Should I do it or not? They have to put a stent. I said, yes. She said, look, my lifetime performance is going to be after 1 month in front of Prime Minister. Should I do this before or after that function? It was really a problem. I mean, if you do it before, suppose there's a complication, and then it will never happen with all our students. If you do it after, maybe before the function, see, that's a problem. You know, it was a TIA. But I don't have any predictive model. So as usual, I told her, look, you decide. Talk to your family, but I can tell you nothing will happen. Our doctors are very good. And lo and behold, she got a complication of that and she was left with the lifelong paralysis and she could not perform that. So how wrong I was, you know, in that. So I think we need to have predictive models for that. And I have a hope in artificial intelligence. I mean, that is and I think that is another area in which. And the third and the most important area of research is on which Dr. Sundar Kumar, our today's chief guest, has talked, that is dementia. I mean, in this hall, I'm very sure half of us are going to get dementia. Some of us may already be having it.
You don't know that you have dementia.
Yes, correct. We don't know. So my mother, she is 91 years old, and she's having dementia for the last 10 years. And she's just lying down. And I remember my mother, how alert she was. She was light of all the functions and all, and for the last 10 years, she's just lying there. And this is something which is hitting us as a neurologist. I know after the age of 65 or 70, almost 1 in 5 is having dementia. Significant, serious dementia. So I think that is another factor, and we have a lot of hope from Brain Research Center and people like you. And I think I really congratulate you that you have chosen the most important topic and the most important researcher who has done significant work. Congratulations once again. So with that, I once again thank you for making me part of this very personal function. And I hope in future we'll look forward to many such lectures. Thank you very much.
Thank you so much, sir. And as always, whether you're singing a ghazal or single-handedly singing a duet or speaking over an oration, it's always as fascinating with or without a glass in the hands. So thank you very much, sir. Can I request Dr. Shashank Kale to share his remarks, his address, because he knew Aashrai as a child, as did Dr. Tarak, and his wife Bhabiji and his in-laws, his mother-in-law and father-in-law, who were there at that time, were there at the wedding of Aashrai. So over to you, Dr. Kale. And the debate between neurology and neurosurgery can continue.
Distinguished guests on the dais, friends, ladies and gentlemen, let me begin by first thanking Dr. Murthy for inviting me here to be a part of this beautiful ceremony. Indeed, we were neighbors for many years ago, and I must have seen them growing up. I mean, I don't remember, but I remember when he got into the medical college, because in an institution like All India Institute of Medical Sciences, people keep watching. Oh, uska beta medical college mein gaya, uska beta IIT mein gaya. Then you keep telling your child, look, that son has gone there. So I remember that being mentioned, that Dr. Murthy's son is now got into a medical college. And then a few years ago, I came to know that he's becoming a neurologist. And incidentally, my son is also becoming a neurologist, and that too in the US. He's in the second year of his residency. And I distinctly remember talking about your son, Aashrai, that look, he did his residency there. So if you're thinking about neurology, I think you should try and get that. So that was about how we were neighbors and how I saw these children growing up. And how one family, one child can inspire a lot of things. You don't even know that, people talk about Aashrai or the institute campus or the families living there still remember. I was, what can I say, surprised, a little bit depressed. The first line of your email, you wrote that, I don't know if you will even remember me. How is that possible, Dr. Murthy and Vishala? It's not possible. In the institute, if you have spent 10, 15, 20 years, it's not possible. Anyhow, so thank you again for making me a part of this beautiful ceremony. And I think you have chosen a correct person for the first award. And in the end, I would just like to tell you a story. The story begins when there was a young doctor. She wanted to be a surgeon, and this is 1950s. This is Columbia University, New York. That time there were no lady surgeons, and she was one of the earliest ones to be accepted into the surgical residency. And the program director of that residency was the famous Dr. Whipple. I don't know if some surgeons here, or you must have heard the Whipple's operation. Very big, very famous operation. So this lady was training under Dr. Whipple. And Dr. Whipple gently suggested her that, look, you're a lady, you're a girl, surgery is very difficult for you, don't do surgery. He was trying to discourage her from doing surgery. And he said, well, if you want to, I want you to first look at anesthesia. First, at that time there was no anesthesia department. Anesthesia used to be looked after by the junior most people in surgery. And so he pushed her into anesthesia, and that too he pushed her into obstetric anesthesia. And so she used to look after these ladies who needed an operation for childbirth. So she was having lunch in the cafeteria once, and one of the junior residents came running to her that this lady is now going into an operation and I have no clue and I am here and what should I do? She said, let me finish my lunch and I'll join you. She said, no, they're going to take out the baby. What should I do? So she said, look at these 5 things. And she jotted it down on the back of a piece of paper which she had in her hand, that look at this. Go look at this and I'll join you. This lady was Dr. Virginia Apgar, and now there is hardly a doctor or a nurse or an intern who doesn't know what Apgar stands for. And this lady single-handedly transformed or gave birth to the branch of neonatology. And the infant mortality rate, which even in New York at that time was here, after Dr. Apgar, it came down here because she discovered 5 things which you need to look in a newborn to know how he is going to be in future. And all these 5 attributes were back channeled into her name. Actually her name, they made all those things fit into her name so that her name is remembered forever. And I think Dr. Jonas here is well on his way to have those 5 letters so that at the other end of the age, we just know that, okay, you look at JONAS and you will know whether a person is going to have dementia or not. I wish you all the best, my friend. Thank you.
Thank you so much, Dr. Kale. I wanted to postpone the acceptance speech so that you could listen to the others speak about you and give you a breather. So if you could kindly just come up and give an acceptance speech. Please, Dr. Jonas.
I thank God for His grace for making me stand here. All glory be to God. I would like to express my very sincere thanks, appreciations to the Gudlavalleti family and the Pressure Foundation and the selection committee for considering me for this award. I'm truly tremendously privileged and also deeply humbled, and I would say that I also go back to my research with tremendous inspiration. I would say that more than a recognition, I think it's definitely an inspiration for me to press on harder in what I'm doing and to carry forward the torch of Dr. Aashrai. And this is indeed a fitting tribute to his legacy, that even though he's not with us physically, in spirit he continues to inspire us and inspire several other younger scientists to keep on his legacy. As a clinician and a researcher, I know that it is not an easy feat to be a sharp clinician and at the same time be an empathetic doctor and also be a very shrewd and committed researcher. And from what I've known and from all what I've heard about Dr. Aashrai, I think he amalgamated all these 3 roles beautifully. And I think that is what every clinician should be. Keeping their clinical skills honed, having an aptitude for research, advancing their knowledge, but at the same time not forgetting to be an empathetic doctor as well. So Again, I would like to thank everybody for your kind words. Like I mentioned, it has given me more responsibility to live up to the words. I will definitely strive my best to make a difference to the society, to the older population, and particularly to the rural Indian population, where a lot of work needs to be done. I would like to dedicate this award to my family, my loving wife Sheba, my children Joshua and Sarah. And I would also like to acknowledge at this moment that where I have come so far is also because of the fact that I've stood on the shoulders of mentors and seniors. I was fortunate enough to be mentored by a very senior neuroscientist, Padma Shri Dr. Vijayalakshmi Ravindranath. And I think as in Dr. Aashrai's life, I know how important it is to actually have a mentor who is really focused on ensuring that you grow in your not just your knowledge and skills, but also in your research career and path. So I would also like to thank the former director and the current director of the Center for Brain Research for all the support they've enabled me, all my research team who has been with me, and we hope that as we keep collecting more data, we would quickly bring out meaningful insights to help the scientific community and the public. And I think with that, I will close once again. Thank you very, very much for giving me this opportunity. I will definitely strive hard. Like I said, this is a moral boost to me. And practically also, I would like to specifically thank the Prasho Foundation and the Gudlavalleti family for the funding. I assure that the funding would be put to diligent use. Specifically, like I mentioned in my presentation, one of the areas which I'm specifically working on is looking at the role of this autonomic nervous system functioning and how it affects brain circulation and brain functioning and dementia risk. So we have recently set up an autonomic functions lab, and so this funding would definitely go a long way in recruiting appropriate people and carrying this research forward. So again, thank you very much, and I assure you that I will strive my hardest to bring this to fruition. Thank you once again.
I think Dr. Jonah deserves a standing ovation for the fantastic presentation. Thank you so much, sir. Can I now request Govindhari Garu and Dr. Rangareddy Garu to just come up here, and we would like you to felicitate. So let's start with Professor Subhash Kaur.
How's your son doing?
So if you could just
Thank you, sir.
put the shawl on, and then we could give the memento.
Thank you.
Can I request the two of you to stay here and Dr. Shashank to kindly come up? Dr. Kale, please. Be careful, Dr. Kale. We don't want an orthopedic injury, especially a spinal one. Thank you. Can I now request? Yeah. Can I request Dr. Taraknath to kindly come up? And of course, the star of the day, Dr. Jonas, if you could kindly come. Can I request Dr. Vishala to come up and receive a memento from the three of them on the dais? Okay. Thank you so much. And can I request Professor Kaul to give a memento to Govindhari Garu? Over to you, Sana, for the good announcement. We're all hungry.
Thank you, sir. As we conclude the memorial ceremony, I would like to express my deepest gratitude to Professor Murthy for graciously welcoming our esteemed guests and setting the tone for this evening. A special thanks to all the guests who paid floral tributes to late Dr. Aashrai and participated for the moment of silence. Thank you to Dr. Anirudh for talking about the remarkable life of Dr. Aashrai. It was very moving. We extend a sincere appreciation to Shri Govindhari Garu for his inspiring remarks. Thank you to Dr. Deborah for joining us online to give tribute to Dr. Aashrai. Thank you to Dr. Taraknath for providing the introduction of Dr. Jonas, which was both informative and extremely engaging. My congratulations to Dr. Jonas for delivering, for accepting this award, for receiving this award, and delivering an exceptional oration for the Aashrai Gudlavalleti Memorial Award. Your dedication to your work is truly commendable. I thank our esteemed guests for presenting this award to Dr. Aashrai. We are grateful to our chief guest, Dr. Subhash Kaul, for his insightful address, and we also extend our appreciation to Professor Kaul, our guest of honor, for his valuable insights and remarks. Lastly, a big thank you for everyone here and also everyone online who joined us today. And we have been receiving several messages online honoring Dr. Aashrai. I thank everyone for their heartfelt messages. And now we can all move ahead for dinner. Please join us at the dining hall. Thank you.